Scoliosis is a sideways curvature of the spine that most often is diagnosed in adolescence. Most cases of scoliosis are mild, but some curves worsen as children grow. Severe scoliosis can be disabling as it can reduce the amount of space within the chest, making it difficult for the lungs to function properly. Severe scoliosis can be corrected with the help of surgery. The most common type of scoliosis surgery is the posterior approach, where the surgeon accesses the spinal column through the patient's back. The procedure involves spinal instrumentation, such as rods, hooks, and screws, to straighten the curved spine and hold it in place. During the operation, the surgeon inserts special screws known as pedicle screws into the bone. The screws will stay safely inside the bone of each vertebra. Next, the surgeon performs a series of resections, where different parts of the vertebra are removed. First, the spinous processes are resected. Then, using a surgical instrument called a burr, the vertebral laminae are cut out, in a procedure known as laminectomy. Still using the burr, the vertebral bodies and discs are then partially removed. And finally, the surgeon cuts the ribs. These resections are repeated at multiple vertebral levels, depending on the severity of the scoliosis. After completing the various resections, the surgeon then cracks the vertebral cortex using a tool called an osteotome. The crack in the vertebral body is then widened using another surgical instrument, known as the laminar spreader. The surgeon then assembles the rods, carefully feeding a straight metal rod into each screw head. The final step in the correction of scoliosis is rod derotation, which is a technique where the surgeon simply rotates the rod slowly in order to straighten the spine, thereby transforming a pathological curve to a normal physiological kyphosis or lordosis.